Hi, it's Danta Hulaiko from DH Natural Medicine Clinic in Southern Highlands. Today I'm going to talk about a very interesting topic which actually our Greek ancient philosopher Hippocrates was promoting, and we are still using it. Let's use food as medicine and medicine as food. So what actually this means? In my almost 30 years of experience, I came across very interesting testimonials from my patients when they came to see me, and the consequences of sometimes irresponsible prescribing over the counter in health food store, online shops, or some practitioners who are not really qualified to dispense certain supplements. So whether it's chamomile tea or whether it's licorice, it's not a beautiful flower or sweet smelling licorice. It's a medicine. It's a chemical message which enters the body and has certain reactions. So I'll explain to you a few cases because I just seen quite few nearly misses due to irresponsible self-prescribing or prescribing by a practitioner who is not qualified. So it's very important to ask if practitioner prescribing your supplements, ask because you need to know. You can't have over-the-counter prescribed olive leaf extract, and I'll give you an example. There's a lot of inferior olive leaf extract on the market, so obviously that's not as potent as practitioner's range, which I use of olive leaf extract. It's antiparasitic, antiviral, and you cannot take it forever. Like you cannot eat chocolate forever because there will be consequences. I'll explain to you the experiences which I've seen in my patients. So if patients taking tablet of olive leaf extract, it's antiparasitic, but olive leaf extract lowers blood pressure in 3 ways. It's diuretic, calcium channel blocker, and ACE inhibitor. So it's brilliant, but a practitioner prescribing needs to tell that basically and know what medication patient is taking. Perhaps patients already taking medications for low blood pressure or other related heart conditions. So I came across a patient who had very low blood pressure for no reason, and having low blood pressure is very rare. It happened to be that she was taking like non-stop 365 days a year olive leaf extract. So as I said, natural supplements, whether over-the-counter, particularly if are in tablets, standardized, whether even not the best quality, act as a medicine. Other classical is kelp. I've wrote so many blogs about kelp. Please, guys, do not eat raw kelp because kelp is one of the strongest goitrogens, one of the most thyroid suppressant. If you like kale, eat it steamed, cooked, whatever. Never eat raw because it's really strong thyroid suppressant. On the opposite flip, it's actually kelp. So everyone knows if people eat seafood, kelp, bladderwrack, it stimulates thyroid function because it's got an iodine. So if someone takes too much kelp, and this is another example when one of the practitioners who wasn't really qualified was selling while doing, some muscle adjustment, kelp to she was in her 90s, living in nursing home, and she had tachycardia, irregular heartbeat, out of the blue. And I kept asking her questions. This is not what I was treating her for, so it was very, really unusual. And then came about that actually she was just buying over and over kelp in powder and supplementing because, she was told it's for energy. This kelp put her thyroids from underactive to overactive, and overactive thyroids cause tachycardia, and that actually causes a serious heart condition. So whatever you're taking over the counter, really need to understand that the best way actually see natural practitioner and naturopath herbalist who actually will ask you question and look for contraindications of medications as well, which is another topic, which I'll talk about other implications or even everyday daily food in conjunction with your medications. Fish oil. Okay, there's so much fish oil on the market. I won't go into technicality of it because it's all on my Facebook, DH Natural Medicine Clinic patient support, but there's a fish oil and fish oil. So fish oil, if you buy cheap fish oil, it's full of heavy metals, nanoparticles. Actually, because of Fukushima reactor incident, which is the irradiated water circulating around the globe, the fish is irradiated. So I use practitioner's range, actually only one brand, which is tested by a third party for all this for good quality. And also fish oil cannot be rancid. So which leads me, if you have, like flaxseed oil, make sure it's fresh, you keep it in the fridge. So topic for another discussion. So it needs to be good quality fish oil, otherwise, you do more damage than good. So as you understand that food has important implications and natural supplements have important implications, but really have to be treated with respect. Thank you.